Apologies for breaking the last one. Knock on the door and then throat's still not good. I suppose the segue from the last one was I was actually talking about the process of recovery from cancer treatment, and I think from here on my accent is going to be the general cancer treatment that you can expect from what we'll call a meta hospital, i.e., I suppose the most common denominator of treatment across all hospitals in the UK. If you're getting treatment for bowel cancer using neoadjuvant chemotherapy in advance of surgery, quite strictly, I just talk about that. That's where I'm going to put the majority of my angst, because I do have a lot of angst. I've got a lot to talk about for that, and also the my personal experience with using cannabis, raw herbal cannabis, and highly concentrated cannabis extracts. For those of you who do already know or use these products, they are generally referred to as RSO, Rick Simpson oil, or full extract cannabis oil, FEK. They are essentially the easily alcohol solvently extracted cannabinoids that contain high concentrations of THC, and CBD. And there are places in Amsterdam that will sort of mix the ratios of CBD to THC. I did during chemotherapy last year use concentrated cannabis oil, about 20 milligrams over that period. I had full remission. It's important again that we start to talk about. I had full remission. I also had looks of surprise from the people who looked at the x-ray at the cleanliness of my bowel afterwards, and I think that was something they weren't expecting. That's something I don't know. You've got to remember I did chemotherapy, radiotherapy, and cannabis therapy. I have cancer remission. I don't know which of one of those three is responsible, so I have to accept that possibly all three of those are responsible. So again, it's important that anybody who watches this or uses me as an example. I now use cannabis to manage, I use it to manage a lot of things. For a start, with cancer treatment, I came home with bags of medications, pharmaceutical medications. And when I say bags, I'm talking about, sort of carrier bags, shopping carrier bags of paracetamol for pain and swelling. Or I have NHS prescription exemption now for the next 5 years. So yeah, lots of paracetamol, lots of a drug called loperamide, which is an anti-nausea drug that works on the opiate receptors, and opioid addicts do like a packet of it. Apparently it's worthwhile getting off on a packet. Not something I've tried. So pain-killing, anti-nausea, which never worked for me. I never really required it because the chemotherapy worked different on my stomach than it did to a lot of people, and it constipated me and almost caused a complete stomach blockage. It's important I don't get sidetracked with anger about chemotherapy at the moment. That's not why I'm here today. If you want to ask me about the anger of chemotherapy, feel free. That's probably at this point I say, look, if you want to, please subscribe, and down below, subscribe to this channel if you're interested in colon cancer. If you have colon cancer, if you're interested in talking about cannabis for colon cancer, if you're concerned about your conventional therapy for colon cancer, talk to me about that, or ask questions and the stuff down below. Leave a comment, subscribe, try and get this channel up. I know it's in double figures already. I only started this for a laugh, really. I think I originally had my son and another guy watching it when I did a few ski videos, and then I thought I slowly have changed the name. So yeah, I've got a lot to rant about. So if you're interested in colon cancer, cannabis, and how to survive cancer treatment. Surviving cancer is, I don't know, some people do, some people don't, but I suspect that the majority of people who die from a diagnosis of cancer die from cancer treatment. That's my suspicion. Please don't take me to court about it. That's not what I'm here for. So, I'm going to leave this as a 5-minute video. Thanks for watching. Subscribe down below. Leave your comments in the links. Start asking questions. Ask me anything you like. I don't have taboos. For those of you who looked at my other videos, you'll know that already. Okay, I don't have taboos.